I'm Riley Nicholson,
And I'm Ellie O'Brien.
and our project's on bupropion. Bupropion is an SNRI, which is a class of antidepressants. Brand names include Wellbutrin and Wellbutrin XR, and bupropion works by blocking the reuptake of serotonin and norepinephrine. Bupropion is used to treat major depressive disorder, seasonal depression, and smoking cessation. It typically comes as an oral medication. It can be taken with or without food, depending on the GI symptoms that occur. And you should avoid taking it at bedtime to avoid the side effect of insomnia. Here are a couple of the main side effects. The most common ones include dry mouth, nausea, headache, and insomnia.
So some important teachings that we found is you can take it with or without food, depending on what your provider orders. You need to swallow the whole tablet fully, so you cannot crush it, chew it, or break it. Do not change your dose or stop it. Stop taking it suddenly. Definitely know the main side effects that we said earlier before taking this medication. The initial dose is 150 milligrams orally once a day for 3 days, can increase to 150 milligrams orally twice a day. The max dose is 300 milligrams per day. The max single dose should not exceed 150 milligrams. So some contradictions that we found with patients with pre-existing seizures should not take this drug or have to tell their provider because it can increase the risk of their seizures. Monitor their blood pressure levels and behavior changes. Also monitor for CNS infection, severe stroke, bulimia, or bulimia, sorry. You should not also, you have to be careful with the toxicity of this. You have to be careful with other drugs that you're taking with this one. And not used for if you're less than 18 years old. So some food and drug interactions that we found. So MAOIs, they raise the risk of hypertension crisis because they both raise norepinephrine levels. And so you're not supposed to take this at the same time, and you have to wait 14 days in between taking both of these drugs if you're going to take them. Another thing is alcohol increases risk for seizures, hallucinations, and anxiety, and so you should never mix these together. And also caffeine increases risk of nervousness, hypertension, tremors, and seizures. And the side effects get worse if you have caffeine with it. So what we said to monitor, serious side effects you should definitely monitor: constipation, decreased appetite, stomach pain, weight loss. Also, you should monitor the blood pressure levels and look at lab results and signs and symptoms. And before taking this, you should talk to your provider and make sure it's the right drug for you and that the dose and form is safe for you, especially with the side effects.